Good luck, everyone. It is Monday, January 25th. I'm sure that there's going to be a lot of questions, so we'll just get right into it. Premier's up first. Dr. Patterson will speak about Arviat and upcoming vaccination clinics, and then we'll get right into questions. Thanks.
Ulasakud luminagadjao January 25. Apekutit sa kalanga yupalo walayo ulumi sibulak to kalimalalu niluta Patterson o kalimasita kwa vermit sa ano amali na may katpisikat talamata.
Grazie a Nunavut mute. Nokkangan ala ala apta. Utak tugut Nunavut nakjwa kalam bat Nunavut doni Arviat. Ublumi manamut ila ublumi mago kanit ta Nunavut nakjwa ta to Arviat katiluk ta fluid 17 ngulit Arviat Nunavut nakjwa kaktun. And Arviat minna. Takwana how did ublumi tikid lu kawi hakta humayu Nunavut nakjwa kangi mangata 6,306 amma 362 hundi kawi hakta humayu. Gihenetana tuhuga kakawena to tana 4,458. Ako Nunavut mute kapiyaw himalyak to Nunavut nakjwa ta rotimi. Mat nakpaka amma koyali yung atakwa kapiyaw lang mata ta nakaput unatang na Nunavut nakjwa mi. Mahan nalo yo kawid nalo kanak mi utakwa kapiyaw ya kakap ta Nunavut nakjwa ta rotimi. Tana kapiyaw himalo owi Nunavut nakjwa ta rotimi. Ta kway kayong nakati nagliyatit ilariyatit nunun nakatitit. Kapiyaw ko latakan lo pagkata ko nanumuluktat 18 umatani ukiulit amma kapiyaw cha ko lugi takwa nunaling nutikin niya lakangata nanulak humata ubluhuna ulakpat ikaka huna ulakpat ay kung nga mga ta takwa tikikaktin nagitay ko kapihin yan niya kung ukaluglo kapiyaw wafi ukalugkupi kautiyaw lutit ubluhuna ulakpat kawihaw namuakpat kapiyaw long na mga pin ta nakawin nakto Nunavut nakjwa tamani hin nakaya kamat Arviat Nunavut nakjwa kangikat talaw lutit nuit kanang mingman takwa malik taw ko yabut anya tailitichi kuni malik chala lo kawin na huitung Nunavut nakjwa nunay iluani hinakaya kamat takwa agawang mikcha talugit ublaludwa tangiluta umahigi taluta niwa katinga yakang na opita kinap pa mi matwa mi atolohi amate kwak va me katigi ka pi katigi bit nalulang ito akola megapi nuwan na ratay kanya kata lammat ta nuwan na ihulagatang niya Arviat mi uta kawi mayung pigutsak to he tama piluk tay kayong na may pit inu katigi chalohi dan Nunavut nakjwa kangilak pa Arviat ni ayakata ko makalwak nga Arviat mi uta ipiyakatigi bapik. Good morning. Well, we're back earlier than I expected. And as we all know, there is another outbreak in Arviat. Today, we are announcing an additional 2 new cases. There are now 17 active cases of COVID-19 in Nunavut, all in Arviat. The total number of persons followed to date is 6,306, and there are 362 persons currently being followed. In positive news, 458 Nunavut mute have been vaccinated so far. Thank you so much to those of you who have participated in the vaccination clinics. Now, more than ever, I think we can all see how important it is to get vaccinated. This vaccine is our best defense against this virus right now. If the vaccination clinic dates have been set in your communities, make a plan to get the shot. This is how we protect our loved ones and our most vulnerable. We cannot become lazy or complacent about COVID-19. Stay aware, stay prepared, and follow the public health measures always. I'm sending strength and positivity to my fellow Arviat mute. I know how hard you're working, and I know how hard this is. We've got this way, and we're going to stay strong. And Arviat mute, I know you will pull through. We will beat COVID-19. Thank you.
Good morning. I want to start off by stressing the importance of following public health measures, keeping gatherings small, avoiding visiting multiple households, and limiting the number of households or visitors from reduce the risk that this virus will spread if someone catches it. Current information suggests that the new cases of COVID-19 in Arviat are related to gatherings in homes. At this time, we have not found any evidence of the infection coming from outside Arviat. With multiple households now involved, increased public health restrictions are as follows. Air and land travel to and from Arviat is restricted. Anyone leaving or entering the community needs authorization from the CPHO travel office. All non-essential workplaces, including non-essential government offices, are closed until further notice. There should be no public gatherings. And visitors to homes, are restricted to emergencies only and no more than 5 people. And schools are closed.
Ulasakut pigaru taharmayo nalona siga kannerlonga pimmariuninga nita ko malittau ge harningin anna harnang ittulerenam malittau kartausimayo ta ko katihatta tu hatsina hatallutik pulare hattang illumi hatigin itatsinno ammalu illumi hatigin itatsinno pulare ta hattang illusi tamanna ulurana runnernersau kutaugunna saarmagunnarningani manno yutusarsimaya ko no ta no vajjarnartaasimayo arviani ta ko turanga yut pularau tihattartuminerne khawisimangitti kutamakko saarma palliani mininginalle silataani ngaarsimamangata nunalingata ajigingittu illumi uhatigit saarma biusimalangata ukko sangilertitaugiartu anna hannangittulerina malittaugialiin khangata yukku nunakkullu tikibbiugunnarning aullarbiugunnarning illu arviat nuqqartitauyun kinatuina aullarnaatuaruni ubalu tikinnaatuaruna angirtaugialik aannaahannangittulleriimmarikku allabbinganu tamakku pimmariungittuni eqqanayarbiit ilagiyaullutik atuutahaluangittu gavamakku allabbingit matuyausimani alertimitniyum taakku silami katiqatigiiqattariahangittut ubalu kikkutuinai katiqattariahanngittu iluani pulareartu angiqariyouyunu tallimakkanni qaakkanningagut illumi uhatigi toavernartukku kissani ilinnerbilimaat matuyauyun.
We are also asking anyone who has traveled from Arviat since January 19th to self-monitor for symptoms for 14 days after they left. We also ask these people to contact the health center in the community they are in to help with contact tracing and monitoring. Anyone who develops flu-like symptoms is asked to contact Nunavut's COVID-19 hotline for instructions. The number is 1-888-975-8601. For the time being, restrictions in other communities will remain the same. However, we will be actively monitoring the situation, and if we identify increased risk outside of Arviat, we will consider changing restrictions in other communities.
Aperimaya vukikkulimaat abberningaarsimayo January 19 minik tammini ujjarsut saaqullugaxanu igutaxan lingiqaluarmangani ulluni 14 unartuni taakku aperimaya vuqauyikkaillutik aannaarbinganu nunanganni taakku ikajornaangata katiyausimayuni qauyusarpalliatillugit kinatuinnaaqanu igutiqalituaruni qanimayurtitu qauyikkeequyaayuq nunavummi Novajornak 19 uqaalavinganu qilamitsautigi qanortiliyaunarmangaarmi qawilutik taana uqaalautinga 1-888-975-8601 maannakainarlitaakku isulittarbiu titauyaasingini nunalinni asijjijaangittun kisianili maannauyo qawisarpallianginnartugu tamatuminga ammalu qawiyigutta tamakko ulureanartumiilerninginni arviasilataaniittut asijjirayarmiyavu isulittarbiu titauyo assinginnu nunalinnu.
To help reduce the risk to other communities, medical travel from Arviat to Iqaluit and Rankin Inlet is suspended for the time being. Appointments that can be done virtually will be, and those patients that require an appointment will be sent to Winnipeg. Medical travelers returning to Arviat from southern Canada have been given the option to remain in isolation for now. I urge everyone in Arviat to follow the restrictions even if you were recently vaccinated. It has been too soon since the vaccine was delivered in Arviat for those who received it to have developed protection. It takes about 2 weeks after the first dose, it takes about 2 weeks before the first dose provides 80% protection from developing serious infection. The second dose increases that percentage to about 94%. And we do not yet know if this vaccine stops transmission. Anyone 18 or over who missed the first vaccine clinic in Arviat can call the health center to make an appointment.
Tamakkuasin inuna liuluanak tumilikkan nehunagit aannear bileartu aulaqattartut Arvianik Iqaluit kangersinang mullumaanna noqqartitau kainarneartu. Initsaliortaussima yuharasaujakko takujauqattarunnerniartut initsaliortaussimalutik ubbaluuni takujaugiarturluti qallunaanu Winnipeg mu aullartitaulutik. Aannear bileartut Ranna bilassima yumini utiqpalliayu Arvianu qallunaani taanna niruartitauniartut suliutaqqikainnarunnarmanga mik taunani qallunaani ajauttoreaqaqqa kikkulima Arviani malitsianginnaqullugi tamakkuninga malittaugiaqartitaujunik allaat kapijaulaurataaqaluartillugin tamannaqilamiuluanga taanna kapuuti sulia atuutaqarunnarsinngimmat Arviani taikkuninga kapijaulaortunu sapummijaugutigonnangimmassuli Makkuunni pinasaarusiinni taanna sivulleqpaami katijaulaortillugit 80% inganik sapummijauli tainnarunnangata. Tulliani kapijaulaortillugit taima 94% mi sapummijauguti userunnaqu taanna kapuuti. Suli qaujimanginatta taanna kapijaussimayu nuqqartitsigutaugunnarmangaasiarmapallianermi. Kinatuinnar 18 ukiiluyunga taanullu sivulleqpaami katijaulaorngippataarbiani uqaalagunnartu aannearbinganu initsaliorlutik.
I want to assure everyone that health staff are working hard to help contain this latest increase, and I urge people to work with the contact tracing and isolation efforts. Rapid response team members are assisting the 8 nurses in the community, both virtually and on the ground. To conclude, I want to announce 3 more vaccine clinics coming up in Nauyat, Iqaluit, and Savikataaq. Savikataaq will be held February 8th and 9th at Patterson High School. Nauyat will hold its clinic at Savikataaq School on February 15th and 16th. Iqaluit will hold its clinic at the Community Hall February 22nd to 24th. All clinics are scheduled from 9 a.m. to 8 p.m. Please call your health center to make an appointment, and additional clinic dates will be announced later this week. Thank you.
Kikkulimaanaluna biigumajakkataakku aanneahannangittulerinem wiqqinayartingiatsuruutihangata tamannaseammappalliakannihunagu ajaortuqiaqqakkaikkajutseaqatauqullugi tamakkua katijaujuminerniqaujisarpalliatillugit ammalu arnittailiqqujautillugit taakkua qilamiujukkikkajuriartiujut taakkua ikajortut taakkuningasitamaujortuni aanneasiurtinginni nunanganni harisaujakkut ammalu ilangitikitsimallutик Piariirutahauma taakua pingasukkanerni kapisseqattalaalengata nunalinni arpa Nauyat Iqaluit ammalu Savikataaq Savikataaq mikapijauqattalaatu February 8 ammalu 9 Patsali ilinnaarvialungani Nauyat mikapijauqattalaatu Tusarvik ilinnaarbingani February 15 ammalu 16 Kingarni kapijauqattalaatu nunalinni pinguabingani February 22 mik 24 mut kapijauqattalaatu ullaasakku 9 mipigiarluti unnusakku 8 munun aannearbissinu qaalaqattarlussi initsaliorlussi qaakkanninga kapijaujuqattarniartu taakkua pinasaarussumi tabbani nalunaertaunearmiu uyannami
Ken Driscoll, APTN National News. Dr. Patterson, your department was able to get out a large number of the vaccines in Arviat prior to this current outbreak. How do you get that second dose out in Arviat if there is an outbreak going on at the time? Can you deliver a vaccine clinic during a COVID outbreak?
Ken Driscoll, APTN kunni taakkua amissugalaalui taakkua Arviani kapijaulaungata sivullerpaami taakkua lutulleani kapijaugiaqarnearsutik taakkua kapijauqattarunalaaqhaan taimaasaarmapalliatillugi nunanganni.
Yes, the vaccine clinics were set up and designed from the beginning to function in a way that would minimize the risk of spreading. Obviously, we don't want to have any of the vaccine clinics result in further transmission. Like everything else, we can never make the risk zero, but we think we can manage the risk well enough that the benefits of getting the second dose into everyone on time will be much greater than the risks of a little bit of further spreading.
Taakkoa kapijau hattarniu aqqittaussimammata pigiangarningani teema aulani hatsaarunnarullugi ulureanartumiititsiktailikannittaililuti taimakkua saarmarbiu hattaqungitsaaqatsigu kapijau biu hattarniartuni teema ulureanartumiinginna niusayuugaluat kisiani teema nalunaarsissimagun magatta tulliani kapijau johalaartillugu kinguvarsimangittuni tamanna attananginersaumasaarmarbiugunnanermu.
Dr. Patterson, last week's false positive involved someone who was involved in or a part of the expedited medical travel program. In light of that false positive, is your department making any changes to the expedited medical program?
Dr. Patterson, pinasaarusiulauttumi taanna tammartaulluni nalunaartaulaungat taanna qilamiujukkuinitsaliurtaugiartussimalluni utisaqaigutiuqattartutigut qanuiliuqaarsimavi taanna asitsertaussimalekkaa taikkua utissaqaittitauqattarunnartun.
No, what happened wasn't really a function of the expedited medical travel program, but more the testing and the reporting. And we're still looking at all of those different things and trying to find, looking for ways that we could minimize another event like that in the future.
Agga taanna aulaniulaortu tamatumunga tikisari ila utersariittitauqattarninginnu pidjutaulaungimmat kisiani qauisartauqattarninginnut ammalu nalunaartauqattarninginnut taakkua qauigasuarniartugu qanu tamakkua teemeittailikannertitaugunnarnaamanga taassavunikkima.
Happy New Year. Arviat speaking from CBC. Tema tuutoinga CBC kunni tema arveani kapisiqattalilormata taakkuat nuvakjuarneq taarnerartaugi kapiosimaaniilorpat. The Arviat clinic had already started. Are those who got infected been vaccinated?
Some have been, but it's not a vaccine failure. Keep in mind it takes at least 2 weeks for the vaccine to start providing some protection to people, and so it's too early for that to have kicked in. That will be sometime next week.
Ilangagu taakkua kapissiqattanermu tamanna ima pidjutiqangittoq taakkua maqquuni pinasaarussiinni kapuutiuyu atuutiqarpalliali tainnassuungumma sapummijauгутиугуннарлуни timittinni maanna qilamiuluangassuli pinasaarussiulaartimik kisaani tamanna sapummijauгутиусsimani qannaamatjuti taaqpalliani pigiali tainnarpallialaarnga
Taakua kapiosimaanniktuit nuvakjuarneq 19 taarsimayui naammaksikpat kapiokanniinnarniarpat nuvakjuarneq 19 qararuartillugi. For those who has been vaccinated and have caught the virus, will they still be given the second dose even though the virus is still in their body?
So the next clinic will be almost 3 weeks away. So the people who currently have active COVID should be recovered enough to get the vaccine at that time.
Skingullammi kapijauqattakkannilaanga tassuli pinasaarussii pingasunaassimalerdillugit taikkua maanna nalunaartaussima yunuvatjuarnartuqarningini ulureanartumiiguti qatsaangittu kapijaukannerunnalaarningit taimaa qanuigunni pallialaangata.
Matisse Arviat, Radio Canada. How are you making sure that the virus isn't going to or hasn't already been spread out in other communities?
Matisse Arviat, Radio Canada kunni qanulli tamanna nuvatjuarna nalunaarsimani aqqiuassinginnu nunalinnuuppallianikkaluarmanga.
We're doing contact tracing on around the cases that have been identified in Arviat and looking for events where that might have happened, and working with individuals who have traveled out and have contacted their the health center where they are now, and working with them to ensure that the risk is minimum.
Takwa kati yaw yung minang nakawisak palit sa utigi yugot na luna si kaswak sa tatamak kuning Arviat ito minangnik. Takwa kawi kaya kulugin nunang iniyan na bingin no tamak ko kayong nakam na kawi kaswak tilugi kiko kati yaw ng mga ata. Kaya maulo ka anak timilit titsitilikan na kamalota.
Do you have any signs that shows you if the virus has possibly been spread in other communities?
Sa maksimatoy nakakaswak viwasin inununalin no?
Not at this point.
Manaw yung aga.
Southern jurisdictions learned a lot from the first wave. They looked at what they had done right, what they had not done right, and what had worked well and not, to better shape their policies and better prepare for the second wave. So I guess I'm asking you the question, considering that cases are increasing in Arviat since Friday, how are you going to be better prepared for a possible second wave of cases in Arviat and maybe in other communities?
Takwa nila kalunani naluna sitsa kataw na si mamatay lipali ko ta kasimalut isivulak pami sa mapalya ni ulak to ni kisu awla ni hatsa sa mga ata kisu awla ni hatsa law ng mga ata ato agalit sa kan na utaw lutillo tamako iligo tigis si mayangit tay may nakit taw van akveani tay mat tulya ni sa mapalya yu jawlak tilugi palungayat sa kan na si maun nakulugi.
One of the big lessons from the earlier stages of this outbreak to where we are now in this outbreak is that transmission in communities is much more likely to be associated with visiting in and between households as opposed to workplaces or other settings. So we will most likely be altering our approach to keep those numbers smaller and keep those household bubbles as small as possible.
Taneli ko tigis man nakpavo tamako sa mapalakat tatilugi tamako sa makatang matano na limni pilo at tumita ko pula ka utakatang ningin nung kami utaw katiging itut kanaya bin ni sa mga nga nakawayan alaw sa mga ito asingin nilo tay mata ko si jakpalya na atavo tay mata makko ilo mi katigi pula ka utakatak hungin naksaw lugi malit sa naksaw katakulugi lo.
Emma Tran for the Canadian Press. Can you point to how this second outbreak happened? There were 0 cases in Arviat for a few weeks, and now we have 17. Does that mean there was undetected COVID in the community?
Emma Tran for Canadian Press ko ni naluna sigun na kaya kanuta natulya ni sa mapalya lang mga Afghani no vadjuan na to haun ni kay nalaw kalawang ata hinasawa ko sigalan ni mana 17 ulang ata kaya yaw smang ito na kay no vadjuan na tulita liminitawa ni.
That's one of the possibilities. The other one is that there was a new introduction event. There's no signs right now of a new introduction, but the contact tracing really only started 4 or 5 days ago. So as that work progresses, we may find more information that lets us give a more definitive answer.
Hindi may tuwid na kayaligtat ko solo no tamig tikibyo ng mga ata kanok kaway madyaw yung hangin makanuta na nunalinaw kanir ng mga tako katiyaw yung minang nipigya tayo nalaw nga tauloy sita mataliman lunas maliktut tayo mga kaway valyalak tigo tamak ko kaway katiyaw si mayo minang kaway sa naksawlok tilugin.
And do you know the percentage of eligible adults who received the vaccine in Arviat?
Say that again.
The percentage of people who received the vaccine.
Kaway mabiyakat si percentingin na yakda ni kapiyaw lang mga ata.
No, not off the top of my head. We can get that for you later today.
Agaman na yung kaway mangita ka kasi na siya ako kanikiyo yaw na lang ayutin.
Justin Petard, Nunavut News. So far, all 17 individuals who have COVID are asymptomatic. How does this compare to the outbreak in November and December?
Tanna Dustin Petar, nunat siya kunik ulumi mo ta ko 17 ulang ngatan wa juan nak thang nakaktaw si mayo kanu ingin nakaktaw lutik kanu tigitay matchay na kasi ballo mi November May December mi lo siya makpalya ni ulang tumi.
It's fairly common for the younger you are, the less likely you are to report significant symptoms, and where Arviat is a younger community than most, it's not that surprising.
Tako ngila nunali pilo tumi makun na saw tilugi ino hatigi ino tapang ko makun na sa kanu igut hangin na saw katang katako ala vene amiso na pangum mata makun na sa tay manere unakto.
The first case on Friday was detected through surveillance testing, and I was wondering if you could go over that process.
Tana sibula panalo na tawlo to kaya samnikut kanu tana ko sri kunak hiwat wakto katang.
Sure, it's part of a common strategy for managing an outbreak in the later stages where you're still within the period where you can't say the outbreak is officially over, but there's no obvious cases. I'll let Uli interpret that.
No, keep going.
Okay. So active surveillance is a strategy where staff on the ground will seek out people who are in areas where they might have been exposed or are in groups, like age ranges where we know there was transmission during the outbreak, and ask them to be voluntarily screened. So if they agree, they get swabbed. They don't go on isolation or anything like that because the majority are negative, but it lets us, it gives us the chance of catching something like this before it gets out of control.
Taman ilagay yayo nunalin ni kanok tu ham na muraw lat siga so hatta tilugi sa mapalya ni unik o haon nang Iqaluit nga taman na kanu ili ko to sa mga kisya ni taman na tukilik kaway sak palya na day ma sa makto halaw tilugo kikutuin nam ni katiya katuin na kaya minam ni surlo ukiyo katigi katikatak tilugi tako sa makbiyo si mga Iqaluit mga ata sa mapalya yo haon ni Iqaluit tilugo ang yaksima unik day ma kaway sa katalaw tugut tay maangit si mayo kaway sak tawlutik kasi anay teliti tayo katalaw ngito tay ma pivikakong nakata kaway kaswarlo tayo kaway si maningit tatin ni tay masayang malawa palala maningin ni.
Trevor Wright, Nunavut News. Do you guys have any idea what the uptake refusal rates for the vaccine clinics, what they are for the vaccine clinics?
Trevor Wright, Nunavut News kunni is kaway mabita ko katsit ang ikatang mga takapiyaw luteo balo katsit kipilo katang mga ta.
It's varied a lot. It's varied somewhat between communities, and it gets back to the discussion, the question that Emma had earlier asking about community level data, and at this point we're still figuring out how to report those and tabulate it. So I apologize for my misspeaking, but we probably aren't, we're not at the point where we can share that data yet.
Does that mean you guys don't?
Wait. Tako jigi katang ito nunalin ni tako ay maapik ko tigi kawaya nga so nunalin ni nga ito ni nasak tao si mayo na kawaya mangit sa katasuli dahil may mat dahil ko tama ko tigi kawaya kalo kailang ito ay mawakaw nangin na masuli kat siulat tama nga ta.
Does this mean you guys don't have any hard numbers yet, or
Hard numbers?
Statistics?
Nasa mavisi nasa ila kasi.
We have total numbers of uptake. We have numbers within for each community, but we're still sorting out the reporting at the community level.
Kagil malakti ko katsi katilugit kapayaw sa malang mga ta malokatsi sa mga ta tunin nunalin ni tako sula kitsure ligalawo katsi ni mga ta naluna taw ni amningin.
Saw a couple of people on the internet fighting about this, but does the vaccine help fight it or prevent the virus?
Takwa karisaw yakutuk takusimayang itaman nakaputi uyok tats mga novadyanak meka piyun ni kutawgunaka.
The vaccine helps your body, helps prevent the serious impacts of the infection. So we know that it makes it much less likely that you'll wind up in the hospital, on a medevac, or in the intensive care unit.
Nakaputi uyong ilay kayong nakakatang atimitin ni timibut. Anna majtita palyagun nakulugan ni amalokan ni maluateligun nakuluta takwalo tay makapayaw si mayo anak balo mungin naksawga kakatak tut ubalo kang atayo ko awlag kaya itong ititaw naksaw katak tut ubalo ni inulisak bim tawngin naksaw katak tut kapayaw si mayo.
Kent Driscoll, APTN National News. Dr. Patterson, one of the frequent discussion topics lately, internationally talking about COVID-19, are the different strains that have been identified throughout the world. I'm wondering, does the government of Nunavut's testing look for the different strains, and if so, what have you been seeing?
Kent Driscoll, APTN kunikluta Patterson ukawsi ulaki katalangan nunak jami taman na tamakwasid si palyayo sangiyok palyayo no badyornay Nunavut government kung itako ni ngakawi sa kung tikakatak no badyorna asid si palyayo ni.
So the routine testing does not, but we have the ability to send some of the samples for further testing, and that's been done. We don't have any results back yet.
Takwa kawi sa kuti ukatak tut agatatsu nga nutani ila asidje palyayo ni novadyorna kumik kawi sa kutaw katang ito tamani Nunavut mi kisa ni awlak ti katak tabo tamakwa kawi sa kutaw kan na hulugit kisa ni utilawng ito suli kawi sa kuti mini.
Dr. Patterson, how many staff usually work at the health center in Arviat, and has your department been able to keep that level up following once Arviat got to 0 cases? I'm wondering, did the staffing levels stay constant, or has there been a drop?
Dr. Patterson, katsiw katakwa akvani anarbing ani kanayak tiyuyut takwa misong ukas mabalusok katsi mangila tay ma nuvadyornak to karun nilaw tilugo.
It's fluctuated a bit, the staffing level in Arviat, where the health centers report into the Assistant Deputy Minister of Operations. I don't typically have the answers on any given day about what the numbers are.
Takwa sidsik tapat to katsiw ningi takwa akvani kanayak tingi anarbing ani takwa anarbing mangiyok kakang atatatsu ma minister ut ugliani ikayok tinganik awlat sinak mo tay may matusak bigi katang itak tanalo kiyugum natnago.
Tobio tak CBC kunik takwa akvani manasangura rapat pura katak na takwa nuk kangayarelit kasuvalik daw lok tilugut pura katarik lutik 28 ni uluni utaking ni ngaklutik. Do you think it was too early for people to visit other house and wait for full 28 days instead?
It's every time we relax on the public health measures, we're weighing the risks that there's COVID in the community and it will flare up again like this versus the harms that are associated with what most people call lockdowns. And the compromise in that is to move not from lockdown to no measures at all, but to move back gradually while we're maintaining increased work to do the active surveillance and other measures so that, as I mentioned earlier, we can, when the numbers, if the numbers start to increase again, we're aware of it earlier and able to respond effectively to prevent a widespread outbreak like happened in November.
Hangatuin na tamak ko kasuyaw valilak tilugan na hamnang ito alanak mo malitaw gali kawis hatakatigo kanulu kaya nak tumigo taw ningit amalutay ko ilo ano nga nunalid ni tako isulit tabiw ti taw yun tayo ma siya makpalalik kan ni kunago Taako hitinga guni mana luna ila wakatigo sa maluyo tigitsutigo tayo matusitsa marigunni kay naktuta khila meungit tumi taako matuyerta valle ala ortugaluat ataw tsikullo khaway sakpallangin naksinartutik nuwadyo naktulinni ila khaway jaw yo haksimangikalo mga taako alo khaway ma ila khila meung sakko khaway gum naksila wakatataman na khila meung sakko kamagigum naksakilak tabutay mga November meula ngani.
Tema isumaru tik karong ngipisita kot naniyaw tilugutan na Nunavut 19 tak tilugu inutu ni raktawluni kanwaru kita kot sama koktukpat ay tukluy koktukpat. Were you not concerned about the spread in the beginning when the person was in isolating? If so, how did it get into multiple households?
When the first individual was diagnosed on Thursday, that may have been sort of like the tip of the iceberg. There may have already been some spread happening. And if we react based on one or two individuals, that could be new spread, or it could be the delayed shedding of virus that's not infectious from where they were infected at least a month ago. It's impossible to know for sure. So on Thursday, Friday into Saturday, we ensured that those individuals were isolated, the members of their household were isolated, and obviously there was a lot of work to do the contact tracing as part of that test, tracing, and isolate strategy. And
okay.
Sorry.
Tana sibulak pa kaway ya manalo na tawlo ni sitam mermita na ilay na kayut sa ulaw Tana siya mapalle si maliriyak tut sa ulaw tugalaw kisana sibulak pa may makunilo ni kaway yaw si malirtilugo. Tayo mga siya mapalagir si mavalay na nga at ubalo taman na king overak si malunite ko. Nuwadyo naktukak tuminita kiulaw tumita ko. Tayo mga pilakito na kaya limini kisani manaw yung kaway nang itsiak tok kisani sitam mermital mermi Saturday milo kaway sa tsali law tugo tamak ko alo anit tayo ko yaw tsaw tigilak sutik ilo miyo kating ilo ambalo katiyaw yung minang nipigiyat tsaw kaway sa palalit tsaw tigilutik ambalo anit tayo ko yaw sutik.
So it was really Saturday night, Sunday morning when there was definite evidence that we had to go back to stringent public health measures and reduce the visiting between all households in Arviat.
Tayo malit natsi ngoya milo lasak ko tayo mga kaway naksilaw ngat tamak ko sangilak palak tayo kan nakayahan na inaanahan ng ituloy na mamalit tayo gali tamalupula ka hatta ko yigunit sa tigil ta.
At Survey Radio Canada, last week there was less than 5 active cases in the isolation hubs down south. Can you give us an update on if there are more cases or if it's the number is still below 5?
Mati Survey Radio Canada kundi pinasako si ulaw tumitali may tungani raw nga tataw na nakalunani to yung mivinani tayo lumito katsiulit kaulume.
It's been above 5 total for a little while now. Right now there's been the cumulative total of cases in the isolation hubs is 14.
Tako ako ni galatan limaw ni katilugi tan limaw katalaw tu galuat kisa ni manaw yung katilugi 14 ulit tu taon na nakalunani nuwadyo anak tuloy to yung mivimito.
There was a false positive case last week in Iqaluit, a person who was part of the expedited medical travel program. You said in an interview last week that you were discussing to making testing mandatory in isolation hubs down south. With the cases in Arviat, are you planning to put that into place before?
Tako tamak tawlunin nuwadyo anak taktaw kan nakatawlaw nga kalun ni tamani pinasako sa ulaw tunitay kwa utisakay titaw hatakto anak bilas sa malaw tuti kalunani pinasako sa ulaw tumapiksok tawluti Ukalaw kabitay masago bekangit tumik kawi saktaw hatam ni alam ningin nakalunani to yung mevimitud tay mahakbyan ni naluna to simulak tilugo sibang magutay makawi saktaw hatalaw koy pataw pa ni.
Not at the moment. The first priority is doing the work that needs to be done to manage the current situation in Arviat. And part of that is to figure out, are there direct links with cases from November, December, or is it a new introduction event? And that may give us further information on the benefits or lack of benefits for testing at the hubs.
Mana yo agaw yo mana li pilirigo ang wala nga tao lat sinang mitaman na siya maktaw palakan na kung nagwakfiani. Tayo mahilaging baguta ko akano turangan na kamangata November, December, Nunavut juang naktokalok to ni Nunavut me. Yung balunutangol lo ni tiki gudjaw ng mga kisani. Tayo mga kawisang naktugo pivali ko titsaw ni ngani kingunego tayo mga kawisay nakatarahan na mga tatangik to ni. Kilawngin ningin ni.
I'm a transfer in NCF News. Or sorry, not NCF, the Canadian Press. I knew I would do that at some point. Can you tell us if the households who currently have COVID, did they ever previously have COVID?
I'm a transfer Canadian Press kung nekotigo nakitigo tamakoy lumeo katigit. Tayo masaya mabios mga tayo lumeo katigino.
Some did and some didn't.
Ilangi aga.
And people at the jail as well as the shelters last week, as well as frontline workers, got vaccinated. Can you tell us about the uptake for those populations?
Tayo ano lat saving meto amalo ang hangit ko meto kapiyaw lo nga tayo pinasa ko sa ulok to me tako amisuno kapiyaw yo kakataw lo ka amisuni.
No, I don't have those numbers yet, and some of that work is still continuing, so we couldn't report it at all until it's complete.
Agata ko nasaktaw sa mga mata sulit ako kasi ani kingunego kawi jaw lak tu galawan.
Ken Driscoll, EPTN National News. And Dr. Patterson, you just mentioned there were 14 positive cases now in the isolation hubs. When in their stay are they testing positive? I'm wondering, like, at the beginning, the part way through testing, or at the end before they get on the airplane. Basically, can you tell if they're catching COVID before they enter the hubs, or is this something that they're contracting while they're in the hubs?
Ketris ko EPTN kunikta ko aluta Patterson 14 ko nakalakata ka bigalo na nito yung mivimi. Anit daily vimi to ta ko pingaswak ta kawi sakta katang ata. Kawi ko nasima katak hinalago ta ko nuwadyo anak ta katang mga ta sibong agut baluta ikani to yung mivimi lak tilugin.
Almost all are people who almost all the positive results are occurring on arrival or within the first 24 hours of arrival.
Arrival to the hubs.
To the hubs. There have been a few cases of transmission inside hotel rooms when people either choose not to or are unable to separate after one individual is found to be positive.
Takoilo na ti kasi tamakkuan pa diyan nakta sa mayut to yung mivimi sila ngingin ni tayo ma ila kawi saktaw gyang agutingan ni kawi jaw hatak to ikakay 24 to ngan to yung mivimi mulaw tilugit ilang ilo ta ko kawi jaw si mayutay ko to yung mivimi lak tilugit sa magbeo hatang ata sa magbeo hatang ningin ni to yung mivimi lo ko singin ni lak tilugit pilo at mita ko katimay na ko mahatang ata ilo meo hatigi ilo sa meo hatigi.
Doesn't Tarna Tech News. If the cases in Arviat are considered to be carryover from the last outbreak, why is it specified that anyone who's traveled to and from Arviat since January 19th are asked to monitor?
Das temperatur na siya kung nita ko ako very made kingulak pa may tayo masang mapalya yung may pigya kutaw na tao tilugi sumalita ko ako very nga to ni January 19 kingunya ko kawi ko sakhan.
The accepted standard when you have a case is to go back 2 days from when either the positive test or the symptoms developed and work from there. If further information leads us to believe that we need to adjust that date, then we'll change our announcements and deal with it at that time.
E mātua tau watu nang e tau simayu tā nātua tau ga yuttu tāko ullu makunu uterea hattaratta tai maa naluna tau yukalau tillugu nuva juanak taak simayu hamninganik asingin nillutu sakkannerutta tamako asidsi hattarnearta vuhangakku tāko ullui hangani pigerlu ni hawi saktau giakamangata.
Self-monitoring for flu-like symptoms seems kind of like what you're supposed to do, but obviously there's a lot of cases that are asymptomatic. Is there nothing that an individual can do at that point?
Tāko ena meni ujasut se ako yau hattangata tai maa hani maguti halingi kalua mangata tāko hani guti hangi kalua tillugi tai maa malitau ga yuttu.
We would be more likely to be testing somebody who's asymptomatic if they had definite exposure. So if somebody from Arviat has traveled outside and thinks they may have had contact with one of the cases that hasn't been identified, they can call the hotline or the local health center and explain the situation, and we would likely be testing them at that time. While that's going on with the contact tracing, if we identify somebody who we know had contact and has left the community, we will contact them directly, get them to isolate, and arrange for asymptomatic testing at that point.
Tāko hawi sa kattartavukis khanui guti hartu yang Iqaluit khata hawi magutta tai maa nuva juanak taak simayu mikatisilla taak tuminiu tillugit. Umbalo tamako arveani ngaatu tamau asingin nunalenno simayu naluna tau pata tai maa khala kattartavu taatsumunga ke khangittumunga sittumu khala viugunnartumut hawi keilu tillu ni annaarbinginni tai maa hawi saqtaule kattartu tai maa kisani tai maa hawi yau yohanna qakati yau simayu ni hawi saqpalle tillugi tai maa katisilla taattumini Iqaluit tillugi aullarsimale Iqaluit tillugu nunanganni tai maa hawi saqtau hasiuti khattarmiyu.
Trevor, Nunavut News. Is there community transmission in Arviat now that it's in multiple households, or is it still considered not community transmission?
Trevor Wright, Nunavut News kunnik nunalinni saarma pallean raqtauleqqaaq veani taakko atsigiingittu ni illumi uqatigiini saarmarsimalengat.
From an outbreak management point of view, the definition of community transmission versus not is when we say community transmission, we mean that there's cases where we don't know what the links are, we don't know how they got it. Right now, we're aware of the links between all of the current positive cases, but because there are multiple households, we've moved to the most stringent public health measures we have in order to reduce the chance that community transmission develops again.
Kai maa saarma palleatuk yuqartillugu aulatsiniuga yuttuni tamannatuki qanganunalinni saarma palleanneraigunnaaqatta ima Iqaluit nakitaakko saarmarbiunermangaata maluqanunuvatjuarnartaarnermangaata maannaajulli qawimayugu tamakko aturaangana qangimmata taimaa kisiani illumiuqatigiini amissuniilerra taima imma sanginerpaani malittaugialinni aaqqitsitsautigisimayugu tamannanunalinni saarmapalleakannernagu.
During at the start, you mentioned appointments are going to all be sent to Winnipeg and Arviat. Does the same go for Medivacs?
Taakko uqaqqaugavi taakko arviani aannerbilaariali qallunaanu tauqattarniarngata taimaatsainartau qangatayuukku tuavernartukkuurtauju taimaitaunermiwi.
Yes, if possible, medevacs will be routed to Winnipeg.
Taimaigunnaruti tamakko tuavernartukkuurtu qangatayuukku Winnipeg muurti tauqattaniartut.
Tobiutak CBC kunnit. Tema ikiaqqivikku suringittuni unikkaani pitaqaungmat ammakangu saarikataktuqorputiklu. Kingullerpaami arviani teemanna atulorsimangmata qanoq oqarumagayarpitaakkununga titerartuni suringittunillu Kangusari na suktunidlo. There are a lot of misinformation and shaming online. What do you want to tell Nunavut as it has taken a toll on Akdalmute and it was discouraging in the last one?
I think there's no place, and we've said this many times, there's no place in this response for blaming or shaming people. Nobody wants to get COVID-19, and there's no place for judging people's behaviors or any of that. The goal now is to support everyone in following the public health measures and reducing transmission. And to be honest, taking a punitive approach is counterproductive, because what it encourages is people not coming forward, people not participating with testing and tracing, and that increases the risk of hidden transmission and increases the danger of it spreading further than we realize.
Taman na ilayin hangit siyaman, taman na lokaw sa rin nakatak si malutigo tayo taman na pasit si katak ko yung itsiya katak kang usari katak ko yung katalo kinatuin na nun ang juwali mami tamatuming ano ba juwan naktak tuka ko mangi kaluangat ang malo ukaw si rin katang ilugasit dinik man na yung lito tuga aga kalirat tayo kayok suy ng mig malitaw ko yun ang miluan na hanang itularin ang mamalitaw galinik taman na siya mapalialik kan na kunago. E mali naktori nga katakot taman na kaung iliro tiyo nga haliro na nga tamak ko malit ning ito mali ko may tuwin na katarahang nga ilaw kataw ko may katatuwin na kahang nga talo kawi saktaw ko na nagmitay may mat taman na surlo kawi yaw si mangito ninuwad yo nakto halituwin na kahang nga taman na ulo kaya nakto may kutaw ko na nga tayo magsurlo kang gusilak titaw sa may pasiyaw sa mayulo ni kawi saktaw katangit pata.
Te maaw katang ng midlo, katang ng midlo, no kaktitaw si marang maagbayani. Tamani de kikiktarong midlo, kitang miyonidlo, kano'y narakpat. The travel restriction is ongoing in Arviat. What about in the two other regions? What's the travel like in Kikiktarong region and the Kitangmiyog?
We still recommend against non-essential travel, but there's no requirement to contact the travel request email address or anything like that.
Mana ya tuli ko yung sulit tamak ko apim makayong ito ni pedyo te karlo te awla katta ko yung itsa kalwa katta kisa ni tamak ko no requirement.
No requirement.
Mana yung tako akaw yung kay gatong ito awla katta ko magut itako na ni asingin David to sa mabiyo yun.
Thank you.